Hello, everybody. I am Dr. Edmond Fernandes, and today I'm going to talk to you about the exam preparations for your paper in community medicine. So, the first thing you will have is the essay questions. You will be given two questions that have to be attempted, each of 10 marks. Now, don't jump into directly attempting this question. You have the option to either take this question first or you can go to the short notes. One thing you need to remember is that this long essay questions is of 20 marks and your short notes is of 40 marks. And then you also have brief notes, which is of 2 marks each, right? So you need to look through whether you want to start with the long essay, you want to go with the short notes or the brief notes. You then also have to visit the number of questions there and see whether you're really confident about addressing those questions or you have some ambiguity. It is always advisable to not begin with the brief notes but either begin with the short notes or the essay long questions, because then you will be completing 60 marks once you finish this, and this is also going to take a sizable amount of your time towards completing this. So for sake of orientation today, I will start with the way in which you should address a long question. You have two options that are usually given. Sometimes in some years, these options might not exist. So let's look at if you're addressing the first question. Define epidemiology, clinical features, complication, prevention and control of measles. Add a note on measles vaccination. Or explain and define case control study with an example. Now you need to be smart and look at what do you know more confidently, because question 1A gives you a breakdown of marks, whereas question 1B leaves scope for what you write. So if I'm in your place, what I would do is I would go for question 1B, wherein you just define case control study and then explain that with an example. That gives you a chunk of your marks. But if you're not very sure, you will have to go to define epidemiology, which carries separate marks, clinical features, again carrying separate marks, complications, prevention, and control of measles. So in this question, your marks will be broken down, which also leaves very little room for you to not be sure, or say if you want to just take the examiner for a ride and you want to bluff some questions, then it does not give you with a lot of room in there, because they are going to read what is the definition you've given for epidemiology, what kind of clinical features are you talking in the context of measles, complications, whether you have written the right complications or you're just generalizing it, and then prevention. Further marks is allocated for a note on measles vaccination. So in question 1A, your marks is divided, becomes very easy for the examiner to see whether you know the content or you don't know the content. Question 1B, you need to define, talk about case control study, give a nice example. The examiner is left for interpreting how much will you score in such a question. So remember, select your question that you want very wisely. Now let's come to question 2A. Explain integrated vector control. then which again gets divided into some marks, and then explain the objective and function of national health program concerned with prevention of malaria in your locality. Now two things break down over here. Objective and function of a national health program is what you need to elaborate. Second is you also need to further elaborate the context of malaria from your locality perspective. So, say for example, you've never been exposed to malaria and you'll say in your locality there is no malaria. Don't say such a thing because you will get a zero for that. You will have to create a hypothesis in your mind. You will have to look at saying, okay, assuming that my area has malaria, what is it that I am going to do in terms of an objective aligned with the national health program? If you're attempting a question of 2A, let's assume you attend question 2B, plan for health education activity in your neighboring village addressing non-communicable disease. This gives you, this question is like a playground. Totally your plan, totally your idea, your village is your neighborhood, and whichever disease you like. You like diabetes, you take diabetes, you like hypertension, you like cancer, you like mental health, you like road traffic accidents, scope is yours. In question 2B, whatever you write will get you marks. In question 2A, you will have to follow content. So if I am in your place attempting this long question, my choice would be question 1B, define and explain case control study with an example, and also question 2B, which is plan for a health education activity in your village addressing non-communicable diseases. This is how I would approach it. Now, what happens after that? When you write, don't write a story. Health education activity in your village addressing non-communicable disease. Create a flowchart. Put a log framework model in place, or put a theory of change. Now, if you don't understand what is a log framework or a flowchart or a theory of change, simply go to Google, understand what the pattern of log framework is and what a theory of change is. So the whole answer, if you address in a log framework or a flowchart or theory of change, it makes it very simple for the examiner to say, yes, this student has understood the subject matter, is talking about a particular activity, has defined a particular village, is addressing a particular disease, the student knows content. This is what they are looking at, of how you will convert a rather theoretical framework into a practical action. A lot of times, why do you feel community medicine is very tricky? Is not because it actually is tricky, but there is a crux here. You're planning for a health education activity in a neighboring village on non-communicable disease. Technically, this is the job of the health department. So, as a student, you are not doing their job, but as a policy maker or as an official, you will be doing this every day. So, what is it they want from you is an issue of non-communicable disease in your village by creating a health education plan. The plan simply means, say, what is the population size of the village, what are the 20, 30 who are going to be potentially in the bracket of non-communicable diseases. Then how are you going to address them, whether you're going to go village wise, whether you're going to go into the villages in terms of different wards and structures, or different panchayats around. That's something left for you to plan. It will mean whether you really want to get into, say, screening, you want to do screening for a particular disease, or you want to do treatment, or you want to just. So you will have to use such questions as a playground for your creativity and we'll now move on to the short notes, each carrying 5 marks, and these are scoring areas. This does not give you an option. Choose your questions here. You have to address it. Let's go by question one: demographic cycle and its stages. Simple, draw the cycle of demographic cycle, elaborate on stages. What I would do in such a situation is I would make a flowchart saying stage 1, stage 2, stage 3, and then stage 1 explain, stage 2 explain, stage 3 explain. So elaborate that. Underline certain important points to catch the attention of the examiner. It's a scoring question. We go to next question. What is pneumoconiosis? Explain different types with an example. Different types with an example is again for you to explain. Don't go on writing a story. Be very brief, saying what is it that you're explaining, and less than half a page for each type. Network analysis, very simple, straightforward. Just write it with flowchart designs. Complete the question. Explain barriers of communication with example. Barriers of communication, you can put a flowchart, you can put a circular format, any of those things, and then give example. Wherever example is asked, you have to give example, you have to underline those things, otherwise you're going to lose marks. Nutritional anemia, straightforward, but don't keep it short. Rather, in such kind of questions, define what is nutritional anemia, then explain different types of anemia, then explain about any policy parameters you might know, and then give some potential examples around that. So where example is asked, give example. Where example is not asked, still give example. That's how you're going to score. What is oral rehydration therapy? What are the indications found to be broken down? Some examiners prefer giving, say, 2 marks for the first question, 3 marks for the question. Some people prefer giving 3 marks first, 2 marks next. So make sure you are somewhere in between, where out of 5 you should at least be 3.5, 4 in terms of your answering capacity. Infant mortality in India, causes and preventive measures. Here you need to talk about various different causes of infant mortality. It could be maternal mortality, infant mortality, then talk about the current situation of infant mortality in India, and then come to the causative and preventive aspects of it. Outbreak investigation. Identify put in the 9 outbreak investigation questions that you will do. Then give one example of a situation where if in an of an outbreak, how are you going to deal with it? This is an examiner would like. Technically, if you do something like this, out of 40, you should be scoring 5 plus. Next, we move to brief notes. In brief notes, by the time you have finished with limited time, you have to address your questions quickly, each of 2 marks. Come to the point. In this, my request will be stop writing lectures and paragraph. Nobody is interested in your paragraph. Just come to the point with underlined titles in bold and then flowcharts. You will get 2 on 2 if you do this much. Water purification in a small scale. Don't simply go on writing stories. It doesn't help. Come to the point, draw the diagram, subheadings, completed. Rotavirus vaccine again. What is the vaccine? When it has to be given, who it is given to, and then the lifespan of it. Integrated counseling and testing center, again likewise. At where it happens, why it is done, which national program creates it. Simply put, what is type 2 diabetes, type 1 or type 2 diabetes, since it's only given diabetes, could be type 1 and type 2. So create a flowchart, type 1, type 2. What is it about? Risk factors, one point examples. That's it. Now, community-based rehabilitation. Elaborate a bit on what is CPR, who needs CPR, stakeholders of CPR. Screening is quite a huge topic. So in such an instance, for 2 marks, you don't have to write 3-4 pages. Just write in brief what is screening, when it is to be done, benefits of screening, usefulness, what is its application in public health. Epidemiological triad. Draw the diagram of agent host environment. Elaborate on agent host environment. Give an example. Accredited social health activist, ASHA workers, you've all heard of them, you've all seen them. What is an ASHA worker? How are they selected? Where they should be from? What incentives do they get? What is their job description? In brief, each subtitle with its conclusions. World Health Organization. What is this UN body? When was it formed? What is its mandate? Why does it exist? Any controversies that exist on behalf of World Health Organization? And what are its functions? That's even brief, how brief you should be for your 2 mark questions. Don't write explanation paragraphs. No, that's not required. Elaborate for your long essay, elaborate for your short notes. For your brief notes, simply just do flowcharts, definitions, subtitles, and quickly convey to the examiner that you know what you're talking. This is all that you need uh, for your exam sessions and preparations. Before you attempt your exam, make sure that you have flipped through all the pages of your textbook. Don't be overconfident thinking you will write whatever comes to your mind. Prose and poetry is not accepted in community medicine. Empty words and jargon is not going to fetch you marks. You have to be precise. You have to read your textbook so that you know what you're writing. I'll give you an example. Let's take integrated counseling and testing center. You can't be vague saying that, okay, ICTC is part of a national program. That's not going to work. Is part of what national program? When did it start? Who is the nodal body for implementing it? All of that needs to be factored in. Merely saying ICTC, part of a national program, you will earn a 0. Which national program, when it was started, who is responsible, nodal departments, you will get a 2 on 2. That's why it becomes very important for reading your notes, reading your textbooks, and having a touch point of each of it before exam. A lot of times we come across students simply trying to connect anything, writing anything for anything. Like, for example, if you talk about what are the symptoms of X disease, they will start writing fever, vomiting, cough, cold. Any disease, fever, cough, cold, vomiting. No, it doesn't work like that. You will not earn any marks if you write such things. You have to be absolutely precise, and you have to have the implementing knowledge. So this is where your public health knowledge is very important, and this is where you will have to be absolutely crisp and certain of what is it that you're writing. And for that, you have to brush up your notes, your textbooks, one day before the exam and also 1 month before the exam. So with this, I think we can conclude the exam approach session. There is not much to be scared about, but remember that if you want to earn marks, stop writing paragraphs and switch to flowcharts, designs, drawings, which convey what do you want to tell in a nutshell. That's what's going to earn you the respect of the examiner, and that's what's going to help you score higher in the exams. So thank you very much. And if you have any doubts, please feel free to approach me and happy to help. Have a nice day. Yeah, I think with what presentation I showed and with some of the points I've given, this should do you well, and your exam should go quite good in the community medicine subject. And I take this opportunity to wish each one of you all the best for your exams and good wishes. Thank you.